Hello and welcome to this session. Welcome to the class. I am very excited to be here again, and we are still on our journey. We are not done yet. How is everybody doing so far? I can see that everybody is really showing me signs that the lessons are sinking, that we are getting a lot of information and getting knowledge enough to confront any emergency that comes our way. Remember that emergency scene management gives you a kind of guideline. It is a guideline, and if you follow the instructions therein, you'll be able to handle that emergency no matter the magnitude and size. Of course, you do what you have to do within the limit of first aid, and then call the paramedics and let them come and do what is within their own scope. So we started the emergency scene management journey. We have already covered two lessons so far. I hope you have not forgotten that emergency scene management comprises of everything you do from start to finish, from A to Z, everything you do during emergency management during first aid. You provide first aid. First aid are those basic care that you provide to the patient who has suffered some injury or who is sick or ill. We call the person patient, and you providing first aid is the first aid provider. So in the first two lessons under emergency scene management, we have seen the scene survey and the primary survey. So just to recap, remember that emergency scene management, ESM, comprises of 4 broad steps. So you have the scene survey, then you have primary survey. So primary survey, and then you have secondary survey, and then the last step will be ongoing patient care, ongoing patient care, and ongoing patient care. So this is step 1, step 2, step 3, and step 4. So when you provide first aid, you go from step 1 and make it up to step 4, and hoping that by the time you get there, your patient will have been helped, or you may not even get up to that point, depending on the speed with which the paramedics arrive. If they come much earlier, you may not be able to make it up to that point. But in a situation where there is delay, or they were not able to get to that area on time, you will have to continue working your way toward step number 4. So we have already seen lesson number 1, lesson that covers scene survey. That is lesson number 2, lesson number 3, and today we're going to see this present lesson will cover secondary survey. What do we do during secondary survey? And then hopefully our next session will focus on ongoing patient care. But let me backtrack a little bit. Just let's go back to the memory lane, just a catch-up kind of exercise here. Remember that the scene survey is when you focus on your safety, your protection, and that is also when you get what? Permission to help your patient. There are two types of permission, remember, voluntary consent and implied consent. Those are the two types of consent, and you have to make sure that you check your safety, because there is no hazard-free area. There is no hazard-free. So the reason why you actually do this and why you should take it seriously, because there are dangers everywhere. Some of them are physical in nature. You should be able to dictate them using your 5 sense organs, but there are also some that are microscopic in nature. They are very, very tiny, very, very small. You can't dictate them using those 5 sense organs. So you have to proactively think about them, and that is why you go for all the protective measures to shield yourself against contracting disease and against transmitting disease. Go back, the lessons are already uploaded. Please, if you have not watched that lesson, if you have not reviewed that lesson, go all the way to that lesson. And then primary survey is the key, is the compass, is the GPS of first aid. This is where you quickly assess the patient RABC. Remember, this is where you check the patient RABC, and the rationale, the reason why you do that is because you want to know if your patient is facing any life-threatening condition, and it is important to know that. You can't just dabble into this. You can't just rush into doing trial and error. No, you need to have a sense of direction. You need to know what is going on, what direction are you heading to, what should you be doing, what should be the focus of your first aid, and this is where you get it. Okay, you need to quickly assess the patient responsiveness, check the airway, check the breathing, and check the circulation. Those are the 4 key areas that you must assess, and that will help you to determine if your patient is facing any life-threatening condition. Please, again, this is very key, very, very important. If you have not reviewed that vision, if you, the lesson, if you have not reviewed that lesson, if you skipped it, or maybe you have not seen it, please scroll down, scroll through the teacher channel. You should be able to see it there. Teacher channel, that's where you can see more lessons. Okay, this is very important, very, very important. Now, secondary survey is where we are at, so we are going to expatiate that briefly. Secondary survey, which is the step number 2 in emergency scene management, emergency scene management. So this is called, this is ESM, and step number 3 is called what? Secondary survey. Secondary survey. What is secondary survey? This is where you also assess the patient. So this entails assessment. You are again assessing your patient. But this time you focus. The reason why you're assessing your patient this time is to identify the non-life-threatening injuries. non-life threatening. So there is obvious difference between primary survey and secondary survey. So remember that primary survey, your focus is on life-threatening conditions. Life-threatening conditions. You want to know if the patient is in life-threatening conditions. That is primary survey. The secondary survey, you also assess your patient to know, to identify. So the focus is to identify some of the non-life-threatening injuries. They may be there, but initially your focus may not be on them because they are not life-threatening. So, but let's assume that the life-threatening conditions, okay, let's assume that your patient was previously facing life-threatening conditions. Your patient was in life-threatening conditions, and then through your effort, through the first aid activities, you were able to bring it under control. And let's assume that EMS is yet to come. So you have a space now. So that is where you bring in secondary survey. And what are you focusing? You assess your patient to identify, to try to cover some of the non-life threatening injuries. You want to see if there are non-life threatening injuries that the patient has. Initially wasn't the focus of what you were doing, but now the primary concerns are under control. You can afford to assess for those non-life threatening injuries. Where do you do that? Which stage of the emergency scene management do you do this? Secondary survey. Secondary survey, okay? So again, this is your focus, why you do it, and so please take note of that. So let's see what you do. I'll quickly tell you what you do here. What you do under secondary survey, there are 3 or 4 things. 3 major things, but I should say 4. Number 1, you obtain brief medical history of your patient. Brief medical history of your patient. That is one of the things you do here. Number 2, you also obtain vital signs. So you take some basic baseline vital signs. So this is where you do that. And number 3, you do what you call head-to-toe assessment. Head-to-toe assessment. So head-to-toe assessment is done here. And then number 4 is you get your patient ready for transport to hospital. Get your patient, if you anticipate, get the patient ready. Okay, get the patient ready in case, or maybe you anticipate that this may result in taking your patient to the hospital when the paramedics come. So this is also where you get your patient ready for transportation to the hospital by the paramedics. So medical history of your patient is taken here. You obtain vital signs. You do head-to-toe assessment here. You get the patient ready. In a case where you anticipate that the patient may be transferred to a hospital, so you need to get ready, get your patient ready. For example, you can get the head card ready and the other things you may need the patient to go to hospital with. So here you do what you call sample. So to get the medical history, you use a sample. So sample will help you ask the necessary questions. There are only 6 questions you need to ask here. And with the help of sample, you should be able to get those questions, you should be able to ask those questions. S means signs and symptoms. S means signs and symptoms. So S is for signs and symptoms. Signs and symptoms. So remember that signs are the things you see on your patient as a result of that emergency. You know, there are messages that condition will have been displayed on your patient and you can see it. So if you can see it, if you can quantify it, those are signs. Example is if somebody's skin is turning pale, or somebody's eyes turning pink, or if you feel the body, you feel that it is too hot, hotter than normal. So those are signs. Symptoms are those you don't see, even though they are there, but you don't see them. You can't see them. They are called symptoms. Example of symptom is a headache. Example of symptom is nausea. Example of symptom is pain. So those are there, but as a first aider operating from outside, you should not be able to see those things. So S is for signs and symptoms. A is allergy. So if you ask your patient, are you allergic? So allergies. M is for medication. So ask your patient if your patient is on any medication at the moment. P is past medical experience, similar medical experience. So ask your patient, have you had this experience before, similar experience in the past. L is last meal, about food or drink. Have you eaten anything? Have you, what have you taken? So let your patient tell you that is L. And then E is event, leading to the problem. Event leading to that particular problem, that situation where your patient is at the moment. What event? We call it the mechanism of injury. What actually led to that? So that is sample. So by the time you go through this, you will have asked all your questions, and based on what your patient has answered, you should be able to make some decisions. So remember, you have to document this, you have to write it down, because when the EMS comes, you should be able to give formal report, and part of that formal report is what you have written. Alright, so vital signs, you can also check vital signs. Hopefully by this time EMS has not come. So let's assume they have not come. So do the vital signs. You do heart rate. So heart rate is one of them. And then you do respiration rate, breathing rate. That is another thing you do here. Number 3, you also do temperature. Again, you don't need any equipment here. All you need is back of your hand and give permission. Is it okay if I feel your temperature? So how does it feel? And then number 4 is what they call level of consciousness, LOC, level of consciousness. So heart rate, how many times is your patient's heart beating? That's the meaning of heart rate in 1 minute. So in 1 minute, how many times? So usually you can do that through pulse. So normally you do this for 15 seconds, and whatever number you get, you multiply by 4 to make it 1 minute. So that is heart rate. Respiration rate, you watch the chest of your patient, chest rise and fall. Remember that the rise and fall is 1 count. So how many times is the person breathing in 1 minute? So if this is an adult, you expect 12 to 20 breath per minute. For pulse, you expect 60 to 100 beats per minute. So this is for adult, okay, per minute. This is for this heart rate. Okay, so again, temperature, how does it feel? Level of consciousness. Okay, you are there with the patient, you are able to tell the level of consciousness of your patient. What answers are you receiving? Those answers, are they appropriate? Are they appropriate? The eye movement of your patient, how did your patient dress? Is it appropriate to the weather? So these are some of the things you consider. And then between, let's assume between 0 and 10, what number? 0 being the worst, 10 being the best. So if somebody is fully oriented to the place, to time, and to person, that is 100%. But if somebody is drowsy, or somebody is very near disorientation, or partially disoriented, not oriented in those 3 axes, okay, I'm not going to give the person 10. So that means in terms of level of consciousness, the person is actually dropping in that. So the person is moving away from what is considered normal, what is considered perfect, what is considered appropriate to something that is not good. So in terms of level of consciousness. So very important that you do that again, document whatever your findings are, because you're going to hand it over to the EMS when they come. Alright? So refer to the book. The book has a detailed discussion. So head-to-toe assessment, head-to-toe assessment. So of course from what is written head to toe. So that means you have to assess the patient from head all the way to the toe. Okay? Head to toe assessment. Again, why are you doing this? You want to know if there are some hidden injuries that are not conspicuous enough, but which is also important and which needs attention. So there are 2 forms of head-to-toe assessment depending on the consciousness or unconsciousness of the patient. So if your patient is conscious, you do what you call hands off. So that way you just give commands and see how well your patient can follow those commands. For example, tell your patient look up and see whether your patient can look up without struggling. Can you turn your neck to the right, to the left? Can you stretch? Can you make a fist? Can you give yourself a hug? These are all assessments. Even though you're not touching your patient, but you are doing the assessment. You are doing the assessment. It's called the hands off. But if your patient is unconscious, then you do hands on. So you start from the head and then gently and carefully walk your way one side at a time. We're going to see the demonstration, but that is hands on. Remember, you need to put your gloves because you need to protect yourself. Okay, so this is secondary survey. So we're going to do the demonstration. We're going to do it. Okay, starting from medical history using sample, then vital signs. Okay, and then we do head-to-toe assessment, and then number 4, usually if you anticipate that this person will be taken to hospital, you need to get the person ready, okay, before the paramedics arrive. Hopefully you have time to do that. So does anybody have any question? Yeah, sample. Yes, sample. Sample, that's the so use sample to to get the medical history. So the medical history we need here is not the comprehensive medical history that nurses and doctors get from the hospital. This is just basic, and 6 questions should be able to do that for you. So you just use a sample, you should be able to know which questions to ask. Okay, signs and symptoms is S, A for allergy, M for medication. Ask your patient, are you on medication at the moment? P is for past medical history, medical experience, similar experience, what has happened in the past. L for last meal, have you eaten? What did you eat? Did you drink anything? What did you drink? And all that. And then event, mechanism of injury. Yeah, so what happened? What happened is going to solve that problem for us, or should be able to help us. So thank you very much, and then we're going to demonstrate this and it will be clearer. So see you in the next session, which will be what? Ongoing patient care. Take care, bye-bye.